Starting to.
You can see me good, right?
Yes, ma'am.
Okay, cool.
All right, so this is Titan Tuesdays. I am Veronica Shanklin, and this is our monthly interview conversation with an expert or Titan in the senior community and in the Alzheimer's community. And so today we're going to speak with Miss Lisa Williams, who is a nurse and the president of Black Nurses Rock, Tyler, Texas. And so I'm going to give you a little background about Miss Lisa, and then we'll go ahead and get started. A dedicated nurse, Lisa K. Williams is an active member of community organizations and founding CEO of Black Nurses Rock, Tyler, Texas. Born and raised in Tyler, she's a daughter of Ellen Jean Williams and the late Arthur Lee Williams. A recipient of the 2012 Health and Wellness Advocacy Award from Alpha Kappa Alpha sorority, Lisa is dedicated to the field of nursing. It is her love, representing an incredible learning experience and wonderful journey helping others. She worked as a CNA since she was 16 before acquiring her vocational nursing license in 2003. She worked for Truman Smith Hospital in Gladewater, Texas as a respiratory therapist while attending college, and she received her BS in Business Administration from Texas College in 2006. She's also a certified assisting living manager. In 2016, she became a diabetic self-management facilitator at Merck with a lifetime certification and an ambassador for the American Heart Association and an ambassador for the American Sexual Health Association. In 2017, she completed and graduated from the BNR Leadership Academy. Currently, Lisa works for Aquinai, how do you pronounce that?
Aquinai
Home Health Agency in Dallas, serving as LVN Field Nurse and Community Liaison for 4 years. She's also worked as an LVN Field Nurse for Nightingale Home Health, and for 5 years, she was the Assistant Director of Nursing at Park Place Rehabilitation Center in Tyler. Most recently, she founded Black Nurses Rock, Tyler, Texas, serving as the chapter CEO. She leads with a mission to empower and inspire innovative leaders to serve and educate vulnerable communities. Currently, she's pursuing a master's in business administration, desiring to become an entrepreneur as a nurse consultant. Lisa has a son, Antonio, daughter, Celisa, and granddaughter, Kaylee. And she lives by the philosophy embodied in the famous quote, "Give a man a fish and you feed him for a day. Teach a man to fish and you feed him for a lifetime." So thank you so much for being with us here tonight, Lisa.
And I also have 2 things to add that I'm really proud of. I just completed the Leadership Tyler program here in Tyler, Texas, class 33, the longest class ever. And I did switch my career around. I'm currently attending Walden University, where Black Nurses Rock have a partnership with Walden University, and I'm completing my master's degree in health education and promotion.
Woo, all right.
That's an update. Thank you.
Yes, ma'am. Thank you. Thank you for sharing that. So clearly, Miss Lisa is very, very well versed in the healthcare field, as she has a number of years of experience working in nursing homes and facilities and CNA and just across the board. So something that we want to talk about today with you, Miss Lisa, is the diagnosis, the Alzheimer's diagnosis, and all the things that come with that as far as getting a diagnosis and, you know, moving forward from there. And so I know that your father had Alzheimer's. And so I kind of just want to start with, can you just give us kind of a little background on your experience as a caregiver for your father and also getting his diagnosis and what that was like?
Well, my mom was the main caregiver, but by me, I had the medical background, and I have a sister with a medical background because I was attending respiratory school when it happened. My father was diagnosed at the age of 58, and that's really young. He was currently working for Kelly Springfield in Tyler when he was diagnosed. And what happens with people when they are going through Alzheimer's, they compensate a lot. And so he will forget things, and he get upset when my mom or I ask him, "Hey, did you do this?" He'll get upset because he was compensating. And as just family members, you're going to ask normal things. That's routine. So by that, they can always compensate and tell you the correct answer. But when it comes to doing different things, they can't act as fast because the disease is creeping in on them. So one of the things about my dad, he was not a drinker. He didn't smoke. He went to work and church and home, and he had a routine. So one time he forgot to get how to get home from my uncle's house, which is not even 2 miles away. And he had to call a friend to come and pick him up, and he didn't want the friend to tell my mom, but he did tell my mom about it. And when she confronted him about it, he became very angry. And you have people that get Alzheimer's, and they might have a happy spirit, and he was one of those kind. But when that diagnosis kicked in, he was very angry once you would correct and say or ask him about something, because he knew deep down something was wrong. So he had things going on at the job. They had machinery coming in he was not used to. It went to a manual to computer. And so he never could catch on. And I think they just really stretched him out because they changed up how they was building tires and doing different things. And it kind of just had him all worked up and upset because he was a provider for his family. So they switched him to where he was like working on a cleanup crew, but still making the same amount of money. So their job did work with him. We went from there, and things started getting worse. He started going and paying for things over and over because he had a farm in Palestine, and he would go buy hay, and he'd keep buying hay, keep buying hay, keep buying hay. So they was like, this is too much, because by then he had so much hay. So the lady, she reached out to my mom and said, he come every Friday buying hay. He buying it. And he had bought so much because that was a habit that he was used to doing, and he wanted to make sure he had enough hay. So that was one thing. And the planning and writing things down, getting dressed, the simplest thing that we take for granted, it became a task for him. So he still compensated. So my mom, she took him to the doctor, and they started treating him for that. And we eventually retired him from his job. And he was very upset about that because he didn't want to stop working. He had to quit driving and going to work, and he didn't like that at all. So you really can't diagnose it. The only way you can really diagnose Alzheimer's is someone's dead. And they do an autopsy, but you can take tests to see what's going on with the loss of bone mass. So he had a MRI, magnetic resonance imaging test, and a CT, and it can tell you if that person has had a stroke, hemorrhaging, and he hadn't had anything. It can let you know if they had a seizure. He hadn't had any of that, and the memory loss was just getting worse and worse at time. And far as the planning, he couldn't think. His sentences started getting where he couldn't do his sentences well. If you caught him off guard, it wasn't a normal question like "How you doing?" and he say "Okay." But if you went with something longer, that's when he'll be like taking his time to respond because he really wasn't getting it. And a lot of times I see with people, Alzheimer's patients look good. They look just like me and you. So you wouldn't even think they have it. So when people see them, they are holding a conversation, they dressed and well groomed, and you don't know till later on that they're not catching on. And so he was always a well-groomed person. So if he never did wander off, he would walk around a block or so around the house. But if you look at him, you wouldn't think, if he did wander off, you wouldn't think to stop him and try to take him back because he's so well-groomed. And I think that's what happened with a lot of people now, because it don't matter what age you are, what color you are, the disease do not discriminate. And I have had patients at the age of 50, 52, 53, they have that same disease. So it do not discriminate. And again, if you look at them, you don't even know they have it until you start talking. And if you're talking about something that might be a little over their head, you might pick up. But if something they know about, they roll with it. And I always ask them how old they are. And that was the biggest thing for my dad. Cause I was like, I wonder how old he think he is. Cause he
Right.
was 50. But I asked him and he thought he was like in his 30s. And I look like my mom. So he always thought I was my mom. And he just did not like her anymore. And people take it personal with caregivers take it personal. Oh, they doing that on purpose. Nothing's not wrong with them. No, it's something wrong with them. That's why they had it diagnosed. And
can I stop really quick? I want to back up really quick and go back to getting your father's diagnosis and getting him to go to the doctor. Was he cooperative? Or
well, that wasn't a problem getting him going because he liked to go. So all you had to do was like, okay, just get your bath ready, just take a bath and come on. Because he was probably thinking he going riding or because he wanted to go somewhere. He wasn't inside and he didn't like sitting in the house. He liked to roll. So getting him to go to the doctor wasn't a problem.
Okay.
So when he got there, he got diagnosed and they gave him some at that time, I think they might have did Prozac. It just depends on the doctor that you go to at that time. And he had an older doctor. Because I do believe now most people get Aracel. It just depends on what's going on. But he went and they did a physical examination. They set up for an MRI and they did blood work. And that's how they did like memory tests.
Right.
And knew that he had memory issues. Because the thing about that, you want to check with older people, not older, just people in general. They get UTIs, they get urinary tract infections, and sometimes they cause confusion.
Right.
So
that's something that I always talk about is being on the offense and not the defense. So if you think that there might be a problem, it might not even be Alzheimer's. It could be a UTI. It could be menopause. It could be hormones. It could be so many other things. That's why
lack of sleep.
Right. Exactly. Lack of sleep. Exactly. Medication interactions.
Ooh, medication's a big one. And I go a lot of times and I do med boxes. And if somebody get medication mixed up, oh boy, you got yourself something because that medication get mixed up. You think you have Alzheimer's patient because it can really turn them around if they take night medication versus day medication. So yes.
So I think it's really important just to stress the point of going to the doctor and trying, seeing what is wrong. Because it could be, it could be anything. And then something else I want to talk about was that back to that process. So it's, an MRI, it's a CT scan, blood work, and they check all these things. But something else that you mentioned they do is a memory exam. So that's basically the test. And so how long ago was this with your father?
That happened in 2003. He passed away in 2003.
Okay.
So that's been 20 plus years.
So, but even still, I've been dealing with this for probably like 7 or 8 years, and it's still a similar process. The
process is similar, but the care is much better because at that time they didn't want an Alzheimer's patient, and I know because I called several places. And the thing about my dad, he was too young for Medicare. Right. Had too much money for Medicaid. Right. So we had to pay out of pocket for his care. And a lot of people, I wanted to try home health. And at that time, they wasn't big on taking care of Alzheimer's patients with home health. That wasn't a thing at that time. So they did have a company here where you can go and it was a daycare and they have Alzheimer's Alliance here. But at that, it was for if you want to drop in or come and get information about it. But it wasn't nothing just where they had the care like they do now. So the care have picked up majorly since that time. Right. Absolutely. Something else, actually really quick, just to explain when we talk about the memory exam. So that's where
the doctor will sit down with the patient and they go over this series of questions, and it's on a scale.
Right.
I think the high score is 24, but I'm not sure, but it's on a scale. And so whenever they go to the doctor, they give them this test and they, see where they are on the scale. And so you'll notice over time as the doctor's appointments, go on, that their score on that scale would start to get lower. But it just kind of gives you an idea of where they are, in the process. They also kind of use it to kind of figure out what stage they're in. But that's definitely one thing that they do. And one of the things that they do is, like, the doctor might say, I'm going to tell you 3 items: pen, apple, book. And so they say, repeat it: pen, apple, book. And then they go on, they do the rest of the tests. Some of the tests might be, telling them a story and having them repeat the story back to them, drawing the hands on a clock. And there's like just a whole list, and you get certain points for what you get. And then at the end they go back. So what were those 3 items that, I asked you to remember? So, you can look it up online, but that's the memory exam, and it's not scary or difficult or anything like that, but it's just one of the things that they do in the process for diagnosis. So I just wanted to touch on that, just to kind of
we volunteered. But when I say we, Black Nurses Rock, we volunteered. Alzheimer's had a opportunity for us to volunteer, and we did the clock, and it was very, very interesting. So many people left out and they said, I think I have it. So we had to refer them to the physician because they couldn't get it. And I mean, that was an eye opener for some of them, because they could get their medication they needed and they go to the doctor. But it was quite interesting.
Absolutely. I always think about, like, for me, I think those tests, because you can find them online, and things like that. But for me, even just to do it at home, just to kind of start off and kind of get an idea. Clearly, I'm not a medical professional, but even if you do it at home and your loved one is not able to, complete the test or does poorly on the test, then you really know, let's get to a doctor and see what's going on. You know what I mean?
Always want to seek a physician. That's what they're designed for. You always reach out to your physician, and that's where you get the most help from. The earlier, the better. Right.
Absolutely. One of the questions I had was, why is early detection? And I know clearly denial from either the caregiver or the care recipient is, a main one, because nobody wants to have Alzheimer's. That's not something you want to accept or something you want to deal with. So if you are in denial, you're not going to the doctor. You're not going to get a diagnosis, and you're not going to, deal with those issues. Are there any other reasons that you would say that early detection is difficult?
Well, a lot of people don't like going to the doctor. They don't trust the healthcare system. They have a problem with going to the doctors. As African Americans, some people don't like to go. Just think about it now. They had the Tuskegee syphilis experiment, and now they have the COVID. So people don't feel comfortable in going to the doctor. And with all these COVID numbers rising and deaths, you may have a slower time getting people in a doctor's office that's up in age, because they always look back and remember about the Tuskegee syphilis experiment.
So then let's talk about some of the warning signs and some things to look for in trying to get a diagnosis, or just wondering, what's going on. Can you tell me some of the warning signs for
some of the warning signs? Could be not able to write and speak in a complete sentence, confusion, doing tasks like brushing your teeth, remember to eat, getting dressed, stuff like that.
And then I also add repeating yourself.
Repetitious, correct.
Definitely, that's a big thing.
They might ask you something, where did so-and-so go? And then you tell them, and then they say, oh, did Mary come back? Or, they say the same thing. And then you pretty much know what they thinking. That's where their mind is set.
I think that repetition is a big thing that most caregivers can talk about. That's what they noticed in the beginning that made you realize, okay, something's not right. And then short-term memory loss, period. Right. Just you know, I just told you that that's what we was doing. You know what I mean? Like, or I just told you, or we just had this conversation yesterday, and coming back and asking the same questions, you know, again. So definitely short-term memory loss, repetition, and then that you got.
And one thing I did notice, he could remember things way back. Mm-hmm. But if I was like, say something current, didn't remember. But if you want to talk about, oh, remember we did this? Like, yeah, he could tell a whole story. But if he just doing something in 5 minutes ago.
Right. Right. And that's what they say. Short-term memory is the first to go.
Right.
That is, and then eventually long-term memories go too, you know, but it starts with the short-term memories, and that long-term will stick for, you know, for a while. So let's talk about, so if to someone who's listening to this who thinks that their loved one might be in the beginning stages of the disease, what advice would you give them?
Seek medical attention. And go to reach out to Alzheimer's Association, not Alzheimer's, but Alzheimer's Association. Reach out and get all the education you need. It's 24 hours, 7 days a week, because so many people do not know what to do.
Right.
Right. It gets stressful because you don't know what to do, and that's why you have those facilities that are set up to get that help. You won't be so worn out.
Right. Something that I also say is find a good and trusted medical team. You know,
right.
If you go to the doctor and you don't feel like this is, because this doctor is going to be with you. You know what I mean? Like through the years, if you don't feel like that doctor is giving you what you need, it's okay to go find another doctor. You know,
yeah, that's another thing we kind of get hooked on. We're not married to a physician. You've been having this physician for 20 years or I don't know, 20 minutes. If you have a physician that can't take time out to answer your questions,
right,
go to another physician.
Right, absolutely.
And I always try to, I always encourage my patients, okay, when you go, let's write this list out. Let's write down what you want to ask. Right. And we can get it over to the nurse. And when you go in your appointment, those questions he can go over with you. But they can answer your questions. If he that busy can't answer your questions, start looking somewhere else. Somebody can talk to you.
Right, absolutely. And definitely taking a list, especially at the beginning of this, when it's first starting, start jotting down those things that you're noticing, you know, those behaviors that you're noticing. And, you know, because once you get in the doctor, you're not gonna be able to remember every single thing that's happened, you know, in the last 2 months leading up to this appointment. So get you a notebook, write down.
Keep you a journal. Because a lot of times when you have Alzheimer's patients, someone may be high fall risk. So you also want to make sure if they fall and what time they fall, what's the pattern of they fall. Do they fall every day, every night about 3 o'clock? Because then that may be a UTI, urinary tract infection. So you want to keep whatever they have a pattern doing, you want to make sure. You want to make sure that they are still eating, because with Alzheimer's, they will forget to eat. So you want to use finger foods because you don't want them to start losing weight. And if you notice weight loss, let the doctor know, hey, they losing weight. So we can get some kind of appetite stimulant to keep his weight maintained.
And another reason that I talk about going ahead and getting a diagnosis and being on the offense is because you can put stuff in place. So if it's like, you know, a medical pill case, they have all different types, you know, the Monday through, you know, Sunday ones, they have digital ones, they have ones that can lock and only open on certain days. A person with Alzheimer's is not going to remember when to take their meds or if they took their meds. So little things like that. Also GPS trackers.
Right, I was just about to say that.
Right.
That's a big thing. And when that silver alert go out, my heart just dropped because I know somebody, family member is missing.
Yeah. Especially, and I always say you don't know what they can't do until they can't do it. So
and you want to make sure they keep a up-to-date picture as well.
Right.
Because if something do happen, you don't want to show a picture when they graduated from high school. We need a current picture of what they look like.
Right. But I was about to say, even with driving, there's a lot of people out here on the road driving in the beginning stages of Alzheimer's that either they don't know it and haven't been diagnosed, or the family knows it, they just can't figure out how to get them to stop driving. So,
or they may live alone and
right.
they just be compensating, because when Betty called, she talking to mom and she asked the mom the same routine questions, and mom is able to compensate and tell her the answers. And once she forgets something, she said, "Oh, I forgot." So
Right.
it's overlooked, and mom is living alone. So,
Right.
but you don't know, she all up and down Broadway turning flips.
Okay. Exactly. So there are a number of reasons, but getting ahead of things, getting a GPS tracker, or putting an app on their phone. So like, you know, on the iPhone, they have a Find My Friends app, or things like that that you can get ahead of, so that it's not, oh my gosh, what happened? You know,
and make sure they keep their routine annual checkups.
Mm-hmm, mm-hmm.
But if they forget, they may forget that. So I always tell family members, if they not around or if they work, get those appointments, get a copy of them, or have the physician to keep in touch with you. Right. Because that way you'll know if something was changed or if something was missed. And then you can see a pattern. Okay, Mom, why you keep missing these appointments? Because, you know, most of the time they're going to make their doctor's appointment. Right. So if they start missing and not rescheduling, it's something going on.
Right. Right. Yeah, definitely. So, you know, there's a lot of things that you can do to try to kind of, for lack of a better way to put it, stay ahead, you know, to try to stay ahead of the things that are the challenges that are coming, and just to, you know, put stuff in place. To people who just, so that was a question about, you know, getting the diagnosis. What about people who just got the diagnosis? Are there things, do you have any other suggestions for them?
Learn about the disease. It's a disease process. The more you learn about the disease, the easier it will be to take care of the patient. Right. Or the family member, because a lot of people, they get, you know, oh, he did that on purpose. He know what he was doing. No, he did not. You have to take your emotions out of it. It's nothing personal. The caregiver will be the first person they turn on. So if you can't handle it, let somebody else handle that, because you're gonna be the bad person, because you have to keep correcting them. And you're going to have to be the one to have them take their medication. You may consider getting in a home health nurse and aide to help with that, ease off of some things off of you. Make sure they have recreation time, find a daycare center. You can take them and they can get out and do different things. They can walk, they can keep moving, exercise, eating fruit. Those are some of the things you can do. And most of all, as a caregiver, have self-care. Right.
Right. Figure out a way to incorporate that into your routine.
Yes.
Yeah. The other thing about getting a diagnosis is, like you said, people take stuff so personally. And so when you know that this person has this disease, it makes you a little more patient and a little more understanding to know why they're behaving in the way that they're behaving. When you don't know that it's coming from Alzheimer's, that's when you're more likely to be like, you know, what's wrong with you? What's the problem? You know what I mean? But when you know what the problem is, you at least I am. I know I'm, you know, far more patient than I probably would be if the things that were happening. So definitely, I think getting that diagnosis, you know, helps with that. So
getting the diagnosis and getting the education that goes with the diagnosis. Contact Alzheimer's Association, where you can get the information you need.
And then also organizations like Dementia Care Warriors, like us, and like Black Nurses Rock. You know, we try to be a resource, you know, and have events. And we have on the Dementia Care Warriors website, we have a resource library and, you know, links to books and, you know, all types of information. So definitely to go online and start doing some research so that you can understand the disease, understand what you're dealing with, and kind of also have an idea of maybe what's coming down the road, you know, so you're not caught off guard.
You know the different stages they go through.
Right. Right. Absolutely. So, do you have anything else you want to, share on this topic, or any other advice?
Well, Alzheimer's is not a death sentence.
Mm-hmm.
Always keep your mind motivated. Read the newspaper every day. And if you see something wrong or feel like something's going on, don't wait till the last minute to go to the doctor. Go ahead and go to the doctor and get some medication.
Mm-hmm.
Let somebody know,
Mm-hmm.
because I feel like people know when something's wrong, but they just try to compensate and hold out longer. But go
Mm-hmm.
ahead and seek the help you need. If you feel like, okay, I can't find my keys, every day I'm losing my keys,
Mm-hmm.
get that checked out.
Mm-hmm. I know one of the Alzheimer's Association has this 10 warning signs of Alzheimer's. And one of the things that they say is things that are impacting like your everyday life. So if you lose your keys, on Monday, okay, I lost my keys too. That doesn't mean I have Alzheimer's. But when you lose your keys on Tuesday and Wednesday and you can't find your keys to drive to work because you just keep losing your keys, now it's impacting your daily life. You know what I mean? So don't think just because you went in the room and you forgot what you went in the room for, that doesn't mean that you have Alzheimer's. But when those sorts of things, or even like you forgot to pay a bill, I forget to pay bills, it happens. But when you're forgetting to pay the bill every month and the lights getting turned off every month, that's when you want to start kind of paying attention and perhaps get checked out or get your loved one checked out. So those are there's some good information and some good advice, and thank you so much for joining us tonight with this information. Can you tell people how to get in touch with you, a little bit more about your organization?
Oh, great. Thank you so much for this opportunity. I really appreciated you having me on the show. My name again is Lisa Williams. Our website is www.blacknursestylertexas.com. My number is 903-245-4587.
Thank you so much.
Thank you.
All right.
Bye-bye.